My book was Typhoid Mary, Captive to the Public Health by Judith Walzer Leavirr. So before I begin, I want to talk about what typhoid fever actually is. It's caused by a bacteria, Salmonella typhi, and is passed through contaminated food and water. It results in fever, constipation, aches, swollen stomach, and diarrhea. In the early 1900s, about 10% of cases were fatal, with a quarter of Americans infected during their lifetime. Of those, about 3% of those who recovered, were lifelong carriers. So cities realized that water was directly linked to typhoid fever, and as they became more densely populated, they tried to implement responses to change that. So Chicago elevated the entire city to allow for better drainage, and New York built a massive filtration system. However, even with these efforts, it was still noticed that there were cases of typhoid fever, and this was because of the germ theory. And basically, it was realized that people could be lifelong carriers that carried the disease even when they weren't infected recently. So typhoid Mary. Between 1900 and 1907, there were 22 cases of typhoid fever through 9 different families, and they are all traced back to one cook. The cook was arrested and forcibly isolated for 3 years. Only after filing a legal case and after a new public health minister was appointed was she released in 1910. However, she had to promise never to cook again. In 1915, 25 cases of typhoid fever were traced back to a maternity ward hospital, and the cook was identified, and it was the same person. This time, the cook was forcibly isolated by New York until her death in 1938. The cook was estimated to have infected anywhere from 50 to 120 people with the disease, ultimately resulting in 3 to 20 deaths. She was presented in a very negative light by the newspaper. Typhoid Mary was a real person. Her name was Mary Mallon. She was an Irish immigrant. She came to New York when she was 15. She lived with her aunt and uncle, and she turned towards domestic service so she could earn a living. She was never aware she was sick with typhoid fever, and she contested the fact when the police came and took her to a hospital. While she was there, she was forced to go and have her stool examined to confirm that she was infected with the bacteria. And she was isolated when she was on the island. This procedure continued to see how long she was actually active with the bacteria. Upon release, she was forced into lower paying jobs, and she took up cooking again because it paid more, and that's ultimately what led to her second arrest. She was isolated on North Brother Island from 1915 until her death in 1938. You can see it there on the right. She was eventually allowed to visit the mainland during specific days, and while she was there, on the island, she developed a new way of life. She worked with doctors to assist in caring for other quarantined patients, and she helped further their medical research. However, she was still a prisoner, and she protested her innocence until her dying day. So the policy changes we saw from this: New York implemented 3 modes of identifying carriers: following those who are infected until they tested clean, investigating outbreak clusters, the most effective, and examining foods handlers' stools and urine. When carriers were identified, vague rules were issued that basically said don't handle food. However, this guidance also had wording in it that allowed for permanent isolation, basically under the vagueness of the word satisfactory. Some cities, like New York, implemented allowance to pay for the people who were isolated or forced into lower paying jobs. Mary Mallon tried to sue the New York Health Department, but it was denied by the New York Supreme Court. It was basically argued that the public health department was given authority over any sick person, so Mary Mallon didn't have any right to go and have a trial. This was furthered by a vaccine case that basically said you don't need to get a vaccine, but you can be arrested, isolated, and fined. So to protect the public. So these policies were met with a lot of support by scientists and the general public because they thought that this was good for almost everyone. However, the isolation was only imposed on Mary Mallon. So the question basically comes down to public health versus individual rights. Where does the individual need to sacrifice freedoms for the good of the public? It's really similar to our current COVID debates with masks and vaccines. How far can the government go to protect people? Mary Mallon was never sick. She was a healthy individual, and she was forced to sacrifice her freedom for the public good. Typhoid Mary has evolved into a negative connotation. dirty, diseased individual. And Mary Mallon did carry typhoid fever, but did this actually deserve a lifetime imprisonment? Typhoid fever is not passed by sitting next to someone. She was not the only asymptomatic carrier either. However, she was Irish and she was a woman, and that has severe stigma during that time period. There were other worse carriers, repeat offenders, people who crossed multiple states and infected people who infected more people. However, she was the only one with a lifetime quarantine. Her case shows the extreme side of public health that takes extreme measures to protect the public while leaving no trust to the individual. The book was good, it was well written, it was enlightening, and the sources were well documented. The author jumped in between ideas and perspectives very easily. However, the book could get lost in small points, and it could have parts where ideas were restated. Thank you for your time.